Okay, now that we've gone over who is eligible for Medicare, how do we enroll into Medicare, and the costs of Medicare, let's take a little bit deeper dive into what does Medicare actually cover? What does it do for us, right? So a lot of people think, hey, I've got my Part A, that's no cost. I've got my Part B, I understand that's 174.70 per month. Is that all that I need? Well, potentially, but let's make sure we understand what Medicare is actually covering and what it's not covering. So, under Part A, if you were admitted into the hospital, you would be responsible for a $1,632 deductible. Okay, so if I were to go to the hospital, I show up with my red, white, and blue Medicare card, I would have to pay a $1,632 deductible. Now, that would actually cover me for my first 60 days inside that facility, or it would actually cover me for a 60-day benefit cycle. What I mean by that is, let's say that I went to the hospital, I paid the $1,632 deductible, I was discharged 5 days later. If I go back into that hospital 10 days later, I do not have to pay the $1,632 deductible again. Because again, that first time I paid it covered me for my first 60 days inside that facility, or if I were to be readmitted within 60 days. Okay. So your Part A deductible is $1,632. If I were to be discharged from the hospital, I go back into the hospital 6 months later, I will be responsible for another deductible of $1,632. Okay. Again, Medicare works off of a 60-day benefit cycle. Now, let's say that I were admitted to the hospital and I was actually in there longer than 60 days. Okay, just to give you an example. So from day 61 through day 90, I would actually have to pay a $408 copayment per day. So from day 61 through day 90, it would be a $408 copayment per day. Also under Medicare Part A is your skilled nursing coverage, okay? So Medicare does provide coverage for skilled nursing stays. The first 20 days would be covered for you at no cost, okay? Maybe you had a hip replacement, you had to have surgery, you were discharged from a hospital, you went to a rehab center or a skilled nursing facility. Your first 20 days would be covered at no cost to you whatsoever. Now, Medicare gives you 100 benefit days in total in a skilled nursing facility, okay? Once we get to day 21, we would then incur a $204 copayment per day. So from days 21 through days 100, we would be responsible for a $204 copayment per day. Okay, so Part A, our deductible is $1,632 if we were to be admitted into the hospital. If we were to go to a skilled nursing facility or a rehab center, once our stay goes past 20 days, we would then incur a $204 copayment up to day 100. Okay, and under Part B, as we've already discussed, this is going to be your medical services, your doctor visits, your outpatient care, preventative services, God forbid you got cancer, chemotherapy, radiation. So under Part B, there is an annual deductible. For 2024, that annual deductible is $240. That is your Part B deductible. Once you have satisfied this deductible, under Part B, you're going to move into an 80-20, meaning Medicare will pay 80% of the cost of your services, and you would be responsible for 20%. Okay? That Part B deductible is usually satisfied on your first doctor visit of the year or your first doctor visit after your policy has become effective. Okay? So once we've satisfied the $240 deductible, we're then going to go to an 80-20 for all our medical care billed under Part B. So as you guys can see, there is some pretty substantial or potential out-of-pocket expenses with Medicare. Part A's got deductibles, it's got co-payments or co-insurance. Same with Part B, we've got a Part B deductible. We've got 20% co-insurance out-of-pocket. So what do we do to protect ourselves against these out-of-pocket costs? This is a situation or a decision where Medicare can get very confusing, right? What are we going to do? This is a very, very important decision. It can be a difficult decision, but you really got to understand what options are out there to make sure you make the right decision for yourself.